Thank you, Ninad. Uh, I joined Dr. Bibi Joshi many, many years ago, almost 30 years ago, for a very simple reason. And the reason was with 6 small instruments, he could change the life of a man. And I thought hand surgery was where I need to go. And I'm going to share some of those instruments and some of those which we've changed over the years through this presentation. First of all is Tunica. You need a good tunique, and there are some disposable tuniques like this one. I had a few. We don't get them anymore in India. They were available for a short while. I cannot trace this person, but this is very effective if you're working beyond the PIP joint, and a lot of work that can be done with just a small tunique, which is very effective and safe. Forceps. You need to have forceps that are fitting well in your hand and don't open too much. 10 to 12 millimeters, not more than that, so that the amount of pressure you need to give is limited and it doesn't strain the small muscles of the hand, because you're going to use it for a long period of time. So don't use large instruments, use small instruments. When you're using tooth forceps, I learned this from Dr. Joshi. Have you seen a tigress or a cat carry its kittens and cubs with the teeth, but the kitten is not crying? So you must use only that much force with your tooth forceps. And you can therefore use it on tendons and nerves, which the textbooks say no, if you know how much pressure your left hand is putting on. The other master instrument without which I cannot operate is the tenotomy scissors. It's called by various names, the Stevenson scissors, but the best way to ask for it is to ask for the dolphin scissor. It looks just like a dolphin, and you get them in different shapes and sizes. The curved one with a blunt tip is the one that I love to use, because when you dissect, and if you see, it pushes aside the neurovascular bundles, making your dissection very, very easy and is very, very safe. Once you've opened out tissues, you need to keep them retracted. I love this single blunt pronged, deep self-retaining retractors, which I got made a cross between Wetlanders and a Gelpi, but oftentimes it tends to come off from the forearm when you're dealing with the distal radius. So a simple wire loop can be fixed on to keep it stable. Kushner wires, the most important tool in hand surgery. You need to choose well. Don't pick up bayonet tips. Don't use freshly cut oblique tips. Try not to use the rounded or the smooth, good pointed one, but very round, completely useless. What you need is a trocar tip. And a trocar tip comes in two sizes. There is a short trocar and the long trocar, because as the wire is being drilled out of the bone, remember, the drill hole is drilled but not filled with metal. It's only when the shaft of the wire comes in contact that the hole gets filled. So you need the entire trocar to come out. Therefore, you need to use shorter trocar tip wires. Always, always, always keep 1.2, 1.5, 1.8, and 2 millimeter wires. And I cannot do without a 0.6 and a 0.8 millimeter wire. Check that your drills can take these small wires as well. In my OPD, I need to remove these wires, and in the side X tray that I have for an emergency to pull out wires, I have a bone nibbler, the most stupid instrument to use, because you'll spoil the bone nibbler. So buy one and use it, because it's the most effective instrument to pull out a wire. It grabs a wire. This one is 4 years old and it's still working. It's a little uneven, but it's still working. It's a beautiful instrument. Curettes. Small curettes, because you need to reach right into small corners. Unless you have curettes which are slightly bent or curved, you won't reach these far corners. This is a Dr. Mahindale's wire tensioner or a wire twister. So important when you're doing small bone fixations. Here's a short video of something seems to have. We checked this, but it's just not playing, so I'll probably move on. But when you need to put small loops to tie up ligament fragments which are fixed with small flakes of bone which won't take wires or screws, then you need to just run a stainless steel wire, and this is a very, very useful instrument there, as has been used also in this case for fusion of small joints. A small periosteum elevator, 5 to 6 inches long, not longer than that, very sharp. If you see the tip, it's beautiful, it's sharp, and it's very useful. A mallet that balances well in your hand and is not big again. It's only 6 to 7 inches in size. So you need to have these small instruments, osteotomes of various sizes, which you keep sharpening. There's a photograph of mine, which I showed in one of the lectures, where on my way to the hospital, I see a dharwala and I get my osteotomes sharpened on my way to the hospital, because at times you don't have a grinder in the hospital. So you might as well do that when the opportunity arises. So because you need these osteotomes which are curved, wide, small, all of different varieties when you're doing very, very fine surgeries, because then a fine osteotome is capable of saw-like sections. A very fine nibbler is absolutely essential when you want to tailor grafts to those small sizes. This is a very useful instrument when you're doing tendon surgeries, and you need to put in a probe, a blunt probe with an eye at the end to try and retrieve or pass tendons. Bone punches. Bone punches are absolutely invaluable, and you need to have them very small sizes so you can push fragments back where they belong before you tend to fix them. And a T-handle is extremely important when you're doing antegrade wiring. And in the last two instruments that I'm going to show you, one is when you come towards a patient with a bandage cutter to cut a bandage from the finger. If it's a child or a very delicate person, they're going to be very scared. So you must have a very small one. And just look at this. It's a very small bandage cutter, just like a big bandage cutter, but this is available. You must have it for finger bandages. And the last is a suture cutting scissor, which has a small cup at the end. You can even blindly cut. It's just lifting up. You don't need to look at the thread, because this is going to hook only one thread and you can cut it off, and you will not leave suture material under the skin. So when you buy your instruments or when you plan your instruments for small bones, remember the size of the tree you cut determines the weight with which you will have to swing the axe. So you must remember that size smaller, force that is applied should be directed and lesser. Thank you very much.